Hey guys, this is Tim from CrossFit San Ramon. Last time we talked a little bit about joint training, getting into full ranges of motion with the joint and also training weak areas in the joint. I want to touch base a little bit on different types of joint dysfunction and what you can do to prevent or to recover from some of those types of joint dysfunction, utilizing that joint training and then also utilizing some methods of manipulating the tissues around the joint to help with that. So as we go into joint dysfunction, there's two primary categories I'm going to touch into. One is pain that's deep in the joint, so things that are like inside that joint capsule is one area. This is one that's that oftentimes is going to need more of a medical check, things like that. Sometimes we can work through the basics to find out if it is something that requires medical attention. I'll talk into that one a little bit. First, I'm going to jump into the second type of joint dysfunction, which I find is more common, is pain around the joint. And so as we look at pain around the joint, we're looking at things like if I were to take my knee here and hit the patella tendon, I can get above or below the joint, tendon pain. I can get pain inside, outside the joint, this type of thing. So when we get into those types of pain, what we're going to need to do is do some tissue work, because that's coming from the muscle has created too much tension. It's pulling on the connective tissue or that tendon where it attaches to the bone, and we're creating pain through that. So we can work on some things with utilizing different types of massage. So we can think of massage as being a massage therapist, a gun, different types of rollers. There's other tools that we can use to get into there. The smaller the tool, the deeper we're going to be able to get with less pain. And so as we think about rolling out a muscle for joint dysfunction, this one's too big. We're going to stick to smaller things here. Okay, so we're going to stick to smaller tools to get rid of that. That's more of a fascial thing. That's not going to help your joints much. And so we're going to stay in some of the smaller tools. Lacrosse balls are great, stuff like that. But you're going to work above and below the joint. So if I find pain here, I'm going to chase it down away from the joint and up above the joint to find where the muscle dysfunction that's leading to that joint pain. So I'll work that. Once I get through that, then I'm going to try to find a weak range of motion and work that. Oftentimes it's best to start with an isometric and then work into slow movement and slowly graduate into more dynamic and heavier loaded movements. It's okay to feel some discomfort in there. We don't want to have sharp pain, that type of thing. If you have sharp pain, then that's when you probably want to check in and see a specialist about that, or find somebody who has knowledge to work with you on that. So that would be your pain in and around, around the joints on that. As we go into deeper joint pain, now we're looking at things like we have the gliding surfaces of the joint, so your cartilage and your the joint surfaces, so you could have some arthritis, that type of thing in there that's causing pain in that joint. Oftentimes that can be exacerbated by an imbalance around the joint. So what we just talked about, dealing with the soft tissue around the joint, can be helpful. And until we go through the process of breaking down those muscles around there, we don't know how extensive that problem is in the joint oftentimes, because oftentimes that will take care of it. We can do that tissue work around there. As I get into those deeper joint issues, this is where it becomes very important to start training full range of motion strength. So I'm getting that joint into its full range of motion and developing the strength out of there. This has to be done appropriately. It's the current range of motion with the tissues as they are. We're not going to try to overstress it and push it too far, but we want to get that range of motion built up and the strength in that range of motion building up. If you're not getting better as you start working on it, then you're doing either the wrong thing or too much. So we need to back down, or again, look into seeing a specialist on that. But it's something where you're looking to get that full range of motion work on there. That's going to get more into the capsular aspect of the joint and working on making sure that all of that joint, gliding surfaces, etc. in there are moving better. And so those are some of the things to look at. Try it out. If you have questions, reach out to us here at CrossFit San Ramon, and we look forward to talking to you soon.